we did about 27 pages on it, so we covered the bulk of alternative and conventional care. What I want to make clear to people is when the government talks about cutting costs, they deliberately obfuscate two issues. One is the government providing of services, of actual facilities, of doctors and nurses, of paying their salaries, of actually having hospitals, clinics that you can go to. The other is paying for a public insurance system. Now, when the government talks about cutting, they talk about cutting those two areas, but they put them together. Alberta and the rest of Canada have always had a private parallel system to the public system. When you go to a family physician, when you go to a clinic, that is a private facility. It is usually doctor-owned, but it is a private, for-profit facility where they pay you, where they are paid out of public money, out of the public insurance system. So when you go to a hospital, it's usually government-owned, sometimes it's privately owned, it really depends. Sometimes it's a not-for-profit. But when they talk about cutting, they talk about actually cutting hospitals. For example, when Klein did his cuts, he actually cut down hospitals, he blew them up in Calgary, he took them from being actual hospitals to clinic facilities, things like that. So he actually cut those down. He cut down doctors and nurses in the public system, he reduced their salaries, he increased their hours. Many of them fled to other provinces, to the states, to the private healthcare system. But he also delisted services. He took services that were originally on the public insurance, things like we used to get eyeglasses every year, now we don't get them at all. We used to be, dental used to be on there, that kind of thing. So when we're talking about private and public, the private system has always been there. They just want to shift more to the private system, is what they're talking about. So instead of the public healthcare insurance paying for your glasses, now you have to pay for it, or your private insurance pays for it. So then they can cry, for example, well, we don't have enough hip surgeries. So instead, now the new private clinics that have opened up, because there was a cut in the public system, now they take over the day surgery for the hip surgery and for the eye surgery and all those kinds of things. So when they're talking about we should have the conversation about cutting public health care, what they're really talking about is just shifting more to private in both the private insurance system, the out-of-pocket system, and the actual cutting of public facilities. So I don't want to give people the impression that we've never had a two-tier system. We've always had a two-tier system. However, it is now pushing more into the private sector. All we have to do is shift it back. This is not a huge issue, not really. When we're talking about how to fund, all we have to do is reshift back into the public system. So they are really trying to confuse the issue, and they never include those when they're talking about cutting for public spending. So when we have this conversation, we have to remember that in some cases we're talking about the physical hospitals and clinics and doctors and nurses and unions that the government is paying for. We're also talking about public health insurance. So that if they aren't providing it in a system, if the government isn't providing it in their system, then we can go to someone else and still have it paid for in the public system. But that money is still going to private clinics. We have to keep that in mind, is that if we want our public money going to private clinics, we have to think about how many of those private clinics do we want? What services do we want them to provide? Do we want everything to be done through public hospitals and public clinics? Or is it okay for us to have a few more of the dentists or orthodontists and have them paid for in the public system? We have to make sure those things are clear when we're having this conversation. So when you get into your little groups, try to remember that there are certain things that are still covered for by the government, but aren't run by the government anymore, and used to be, or ones that have never been run by the government but were paid for by the public system, but that money is still going somewhere else. So you have to decide not only how we're paying for it, but who do you want to get the money?
Great, thanks.